So we have Dr. Anshu Kumar from West Bengal, and this is going to be very interesting as we ask some very simple questions for our viewers for better understanding. So according to you, what is an overactive bladder and how does it impact the quality of life, actually a person?
Overactive bladder is basically some constellation of symptoms like increased frequency, urgency, and nighttime frequency. Sometimes it's associated with leakage of urine also. Basically, we divide overactive bladder into a dry type and wet type. Okay, in wet type, it is associated with leakage of urine. So it impact on quality of life is very much dreadful for the patient. Basically, the wet type, in that the patient is afraid to go to any public place where he is afraid that he will get urgency, then where will he find the bathroom, will it be available nearby or not. And sometimes in wet type it's associated with leakage of the urine, which is very shameful situations for the
Very
patient.
embarrassing.
Okay, embarrassing.
Yes. So, why do you think a patient with an overactive bladder delay their visit to a healthcare specialist to get their condition checked out? Is it because they feel it is not a significant condition to be diagnosed? Is there any possibility?
Definitely, sometimes patient feels that these things are associated with infections and all, then it will go in some days, but they don't, they are not aware that these things will be carried on, or these symptoms will increase further if they don't get urgent treatment. No?
So, how early a patient should come to the clinic, as soon as he gets to know that he has a problem, or when?
Definitely, he should visit as soon as he gets to know that there is problem with him.
Okay, okay. So, what are the cons of a delayed diagnosis if it happens? Can you please share an example wherein you have been gone through such sort of cases where an overactive bladder delayed their visit to a doctor and there was the impact on their life, actually health? There was any incidents when you came across a patient who delayed their visit and then when he comes to your setup?
Yeah, there was a patient who earlier used to experience only frequency, and he delayed the treatment. He did not visit the doctor for a prolonged period of time. Then it later progressed to urgency, urge incontinence, and leakage of urine. So, if earlier, if he comes to us, then it is well managed by the exercise and the pelvic floor muscle exercise and all those things. No?
Well, what role does a behavioral therapy plays here when it comes to the OAB?
Definitely, behavioral therapy has good role. Means behavioral therapy is the first line of management for overactive bladder. So first, behavioral therapy should be tried, and more the drugs which are available that just relieve the symptoms. And the main cure is by the behavioral therapy and the pelvic floor exercise and all those things.
Thank you so much, sir, for being here.